The last article featured in the Go Wisdom magazine is Jill Hosey article titled Phase 1 as Clinical Foundation, Clarifying Process and Decision Making in EMDR Therapy with Complex Trauma. Jill Hosey's framework for organizing Phase 1 of EMDR therapy when client has complex trauma focuses on how clinicians can safely pace treatment and determine a client's readiness to process traumatic memories. To translate a client's complex layer history into an actionable treatment plan, he recommends using the 5Ps framework. The first P stands for presenting difficulties. These are the specific symptoms and problems that are currently disrupting the client's daily life and bring them into therapy right now. So by carefully exploring these issues, clinicians can prioritize their immediate intervention goals and anchor their pacing decisions in the client's present reality. The second P is precipitating factors, which are the current activators or triggers. This might be a recent relational rupture or workplace conflict that destabilize the clients and activating older maladaptive memory networks. So clarifying these triggers help identify early targets for reprocessing. The third P represents predisposing factors. This involves early relational experiences, chronic neglect, or repeated adversity that shape the client's core beliefs. While these factors provide crucial developmental context, they should not be targeted prematurely before the client's internal resources and ego are sufficiently strengthened. The fourth P is perpetuating factors, and she identified this as the most clinically decisive domain for pacing. These are the present patterns that maintain a client's distress, such as ongoing self-harm, severe sleep disturbance, or persistent dissociative coping. If these factors indicate the client's nervous system is operating near its threshold, trauma processing must be delayed in favor of stabilization. And the fifth and the final P is protective factors. These are the client's existing adaptive network, resiliency, and supportive relationships. Identifying and strengthening these factors guides the preparation phase and provide the essential adaptive information needed to support trauma processing later. Ultimately, by organizing the clinical data through the 5Ps, EMDR therapists can ensure their target sequencing is not driven simply by the emotional intensity or a memory, but by a structural understanding of a client's present-day stability and developmental history. Once the data is organized, how does a clinician decide if it is time to begin reprocessing? Hosey emphasized that just because unprocessed memory exists, it doesn't mean that it is time to process it. Determining readiness is a dynamic process, and then it depends on 4 key variables. The first one is clinicians must evaluate the stability of clients' affect regulation across sessions. If a minor activation leads to prolonged destabilization or sleep disturbance, then that means that more stabilization is needed before trauma activation is introduced. The second factor is the clinicians assess the consistency of dual attention. Can the client maintain present moment awareness while simultaneously accessing disturbing materials, or do they collapse into dissociative coping? If dual attention is lost, bilateral stimulation will amplify fragmentation rather than promoting integration. The third factor is that a therapist should look at the interaction of perpetuating factors with current stressors. If a client is actively dealing with severe insomnia or relational instability, immediate trauma processing may simply intensify their dysregulation. The last factor, readiness, depends on the accessibility of protective adaptive experiences. Does the client have a reliable sense of safety, competence, or connection to support them? So by rigorously applying the 5Ps and addressing these dynamic readiness factors, EMDR clinician can ensure that their pacing decisions are anchored in structured clinical data, making trauma processing safe, sustainable, and truly integrative.